Joining us now is pulmonologist and MSNBC medical contributor, Dr. Vin Gupta. Doctor, the overwhelming criticism from health experts is that this report lacks specifics or any real actionable items. In fact, the executive director of the American Public Health Association says very blatantly, quote, "If one of my grad students gave this to me, I'd send them back to work." What about you? Are there any takeaways from this report that have some meat to them?
Well, Anna, the things that have meat to them shouldn't surprise you and I and your viewers. It's a focus on vaccine injuries. It's a focus on autism research, opening up a new center. It's a focus on fluoride in our drinking water. Those are the only things we're seeing in this MAHA agenda for children that actually have some substance to it, meaning resources, funding. Shouldn't surprise us. This has been his pet agenda for much of his life, adult life. So the fact that that's really taking center stage, not surprising. But it's really, frankly, just a marketing ploy. MAHA is not what we're realizing now is there's no substance to it. It's marketing. They're really effective marketers, but that's really all it is. And it's also full of contradictions, Anna. You know, I think about their focus on SNAP and providing healthy nutrition to children in schools. How can you do that if you've defunded SNAP and Medicaid, the critical elements, critical policy levers to actually provide kids with healthy eating in schools? You know, they want to focus on air quality and water quality. How can you do that if you're defunding the EPA at the same time? They also want to focus on the drivers of ill health and morbidity, mortality amongst kids. Anna, it turns out the leading driver of children dying in the United States is gun violence. That's number one. Number two is traffics. And what do? They're not even talking about that. And so there's a lot of contradictions here.
Yeah, that stood out to me as well. It was the gaping holes, what's missing when they don't talk about food insecurity, when they don't talk about gun violence, when gun violence is the leading cause of childhood deaths. You talk about how there are aspects of this report that seems to conflict with Trump administration actions. The government-funded SNAP programs provide healthy food options for low-income Americans. 2 months ago, Trump signed sweeping legislation making significant cuts to SNAP funding. The report also pushes new research initiatives that, Kennedy identifies need to be studied. But President Trump's made significant cuts to scientific funding since taking office. Can they have it both ways?
I hope not. If this is going to mean anything for the health of the country, health of our children, Anna, there needs to be substance and resources to back the actual marketing phrase. And MAHA has become just that. It's a label. There's really no teeth to it. I look about ways in which they've actually disappointed their own base. They talked about ultra-processed foods. You're right. It's waffle words. It's research. We already know ultra-processed foods are bad for human health. Why not go the next step and actually put labels on foods saying that this has ultra-processed foods, help guide the American public in a meaningful way? They signal they do that during the election. What do they say here? More research. We don't need more research. They talk about pesticides. So much of RFK when he was running for president on such a focus on pesticides and environmental health. What do they say now? They actually said that they're going to work with the agricultural lobby and find new solutions to circumnavigate some of these toxic pesticides, but nothing direct here. So a lot of words, a lot of waffle words, a little substance.
And a lot of leaving it to the entities in control of some of these things, some of these entities that are looking for profits. Dr. Vin Gupta, appreciate you. Thanks for shining light. Up next on